Hey everyone, welcome to Project Echo. Today is Wednesday, April 15th. Happy Wednesday. Can't wait for Friday. We're glad that you all have joined us. We look forward to today's session. It's actually going to be presented by one of TDH's employees, Annie Baker. She is our Hepatitis C treatment coordinator. She's going to present on hepatitis C treatment and case management just to showcase how our program assists providers across health departments with case management. We will have case presentations today. For those who have routinely attended, we typically do two unless it's a case presentation session. However, today we do have three. So hopefully we will be able to get to all three. If not, though, we will save one for next week or next session. If you are interested in receiving the free 1 hour CEU for participating in Project Echo, please make sure that you register through the Southeast AIDS Education and Training Center. You can use the QR code on your screen. This is not necessarily a requirement. However, it is an opportunity to receive a free credit. Participation is required for the entire session. Once the session is completed, there will be an evaluation link for you to complete, and then you will receive your certificate at a later time. Kimber has also dropped the link in the chat if that's easier for you as well to do the registration for the CEU. If you do have any issues with technical support or need technical support, please don't hesitate to reach out to Kimber Miller. Her information is in the chat, and she can assist you with technical issues. We all know Zoom can be a little challenging, so please don't hesitate. I do see that several have included their information in the chat regarding introductions. Please feel free to continue to do so. We welcome previous and new participants. We're glad to see that the number is growing. So I do see that our SMEs or subject matter experts have all joined. So we are going to go ahead and move forward with today's session. And as I mentioned in the beginning, it is going to be presented by one of our own, Annie Baker. She is our hepatitis C treatment coordinator within the Tennessee Department of Health, and she's going to showcase how our program assists providers within the health departments across the state with case management of clients who are on hepatitis C treatment. We're not in any way suggesting that this has to work for your program. However, we have had great success with this, and we're looking forward to being able to share this information with you. So I'm going to go ahead and turn it over to Annie.
All right, thank you. Sorry, I'm trying to get my computer going too. Okay, so like she said, my name's Annie Baker. I am the treatment coordinator for hepatitis for the Tennessee Department of Health, and today we'll be discussing hepatitis C treatment and case management. For disclosures, I have nothing to disclose. The objective is by the end of the session, participants will be able to identify case management practices through hepatitis C treatment. The treatment initiation. Okay. So patients are seen by a provider via in-person clinic visit or telehealth platform. Pre-treatment labs may be collected at this visit if not previously obtained prior. During intake, the provider discusses treatment options, patient's readiness for treatment, and reviews laboratory results. For uninsured patients, the provider completes the patient assistance program application and submits to the drug manufacturer. For patients with Medicaid or commercial insurance, a signed prescription is sent to the treatment coordinator to complete the prior authorization. For all patients, once ready for treatment, a notification is sent to the treatment coordinator, which begins the case management process. The next slide. Okay. So for our uninsured, we use the patient assistance program directly through the drug manufacturers. Patients are encouraged to bring the documentation to their appointment. Things that are often required is proof of income, which may include pay stubs, tax returns, etc. And the treatment coordinator or appointed contact is notified of patient's treatment initiation process. Next slide. For the insured, I think I already said some of this, the prescription is signed and forwarded to the treatment coordinator or the contact, who is then, we are notified through REDCap database is what our health departments use, and documentation is also in the electronic health record. Next slide. At the provider visit, the patient should be informed that the hepatitis treatment coordinator will be in touch with them to discuss medication delivery and treatment follow-up. The patient should be encouraged to communicate with treatment coordinator regarding medication receipt and start date. The patient can be provided with a patient education handout that outlines the expected process, and we have an example on the next slide. So this handout outlines the expected process and contains treatment coordinator's contact information for the patient's awareness. This handout has proven to be very helpful in keeping patients engaged by knowing when to expect a phone call and what number to watch for. So the hepatitis treatment coordinator is notified that all intake and screening measures have been completed and the patient is ready for treatment. So for uninsured patients, the coordinator communicates with the drug manufacturer to assist in patient approval through the patient assistance program. And then for uninsured patients, the coordinator completes insurance-specific prior authorization form via Cover My Meds online and submits chart records. Once approved, the prescription is then sent to the specialty pharmacy. Some specialty pharmacies may offer assistance with prior authorizations if needed. If so, a provider agreement would need to be completed and then the chart and prescription can be sent to the pharmacy. They will then fill in all the required information on the prior authorization form and then return for the provider or a designee to send to the plan. Once approval notice is received, the treatment coordinator contacts the patient to inform of approval and to discuss delivery of medication. Patients do have the option to have medication delivered to their home or to the provider's office. These are a few insurance challenges I've encountered. So I will check the insurance formularies and notify a provider if they have selected a medication that's not listed. This allows them to change to the preferred medication if eligible, or to provide documentation supporting a formulary exception. Some plans are specific to whether they prefer brand or generic. So if I receive a denial for the generic, I will submit for brand and then likely receive an approval and vice versa. Some insurances still require a genotype. I've had some success with submitting a letter stating the AASLD guidance regarding pangenotypic medications, but if the insurance insists on a genotype, then the provider is notified of the additional lab needed. High copays. When there is a high copay, some specialty pharmacies will assist the patient with applying for the copay assistance to the manufacturer. If the pharmacy doesn't do this, then I'll assist the patient with doing so. If the copay is beyond the assistance maximum, then I or the pharmacy can provide the patient with alternative assistance through Hepatitis C foundations. A few insurances will require a consultation with the specialist or documentation that a specialist may be consulted if needed. With these, I have had a letter documenting access to specialists through Project Echo, and it's often accepted. When a pharmacy attempts to process the prescription, they may be notified that the patient is currently in a grace period. The grace period often means that monthly premiums are not paid up to date and prescription coverage is not available during this time. For this, patients are going to have to contact the insurance company directly. Patients are instructed to notify the treatment coordinator once they receive their medication and begin treatment. The coordinator will review prescription instructions, how to take the medication, and to expect a follow-up at 2 weeks. Patients may contact the treatment coordinator with any side effects, questions, or concerns. And then at 2 weeks, the treatment coordinator contacts patient to discuss side effects, encourage treatment adherence, and reiterate hepatitis C education. During this follow-up, patients are encouraged to schedule refill if not already done so. They're given instructions to change out their personal hygiene items such as razor, toothbrush, fingernail clippers once they have completed week 4 of their treatment. They are also reminded to notify the treatment coordinator of treatment completion. So I will follow up nearing the end of treatment to ensure completion and discuss with the patient the test of cure date. Reinfection prevention education is also provided. When the patient is then contacted when SVR 12 is due to remind them to schedule a lab appointment. Throughout the treatment process, the treatment coordinator is a resource to the patient and provides any necessary follow-up as needed. All contact attempts and communication with patient and pharmacies is documented in the electronic medical record with the prescribing provider tagged. Also, the treatment coordinator is tagged in test of cure results so that SVR 12 data may be submitted into REDCap for additional tracking. Any questions?
So while you all are pondering on some questions to ask Annie, a couple of things I want to throw in here that may be unique to our public health setup. Um, so Tennessee's public health system is across the state. We're divided into regions, and I, some of you may have noticed that on some of the slides it said hepatitis C treatment coordinator or appointed contact. So when we started this process with having a centralized case manager, aka Annie, we offered this opportunity to different regions across the state. And so it's one of those opt-in, so they can choose to have Annie centrally case manage their clients that are initiated on treatment, or some regions may have someone that they wanted to appoint to handle their clients that are initiated only in their region. And so I wanted to highlight that as not all of our regions are are participating in the centralized case management. However, even though they may choose to handle it slightly different, the process is still pretty much the same, whether it's through the treatment coordinator or the appointed contact. And so one thing I do want to point out is although we do utilize REDCap as our tracking mechanism per se for this project. I've seen things such as note cards, postcard, or not postcards, but like the thought just left me. People use them for flashcards. Um, they're the small cardboard little card. But anyways, I've seen people use that like in a Rolodex type system or a binder type system in order to track index cards. Yes, thank you. Why that left me, I do not know. But I've seen those types of systems throughout different facilities as well be utilized to help keep up with patients that are on treatment. That way you know when to contact them, when they started their treatment, when they're going to be due for a refill. We just prefer to use the electronic system just because of the notification and tracking mechanism. So I know that we do have several providers and staff on this call that participate in discussions with Annie and then also centralized case management. So if you've had a good experience or if you have a comment, please feel free to come off mute and talk about it.
I sent a chat for Annie. I appreciate everything she does for our patients here at Washington County Health Department. We have recently cleared 7 cases of Hep C. So kudos to all of the hard work here and to Annie. And thanks, Lindsay, and everyone for these echo sessions. They are a huge benefit to us.
That's great to hear, Mary Beth. Thank you. And one other thing too, I don't mean to dominate the conversation, but one other thing I do want to highlight, and I typically say this at the very beginning, but although our Project Echo series is ran out of the Department of Health, um, it's not necessarily just focused on the Department of Health. Our mission and our purpose is to expand hepatitis C treatment access and information across the state, whether that be to internal staff and then also to external community partners. So, as most of you all who have participated in the past, we have participation from all over. I think today we actually have someone from California. So, we welcome all participants, and we encourage you all to share the information and the word, as we just really want to see patients get treated. So, any questions? All right.
I'll add kudos to Annie. I know how bombarded and overwhelmed I feel some days just with my 14 counties and my what I do as far as the treatment, follow up, and navigation. So I can't imagine covering as much territory as she does. Kudos.
Thank you, Dana. We appreciate you all too. Again, for those regions that you manage your counties, um, you do amazing work as well. So we really appreciate you. And you all are great to reach out with questions and, comments or concerns. So you're doing a great job as well. Annie, can you talk just a little bit about the importance of, I know we've said this before on different sessions, but one thing that may make this process a little bit easier for you, was really building that relationship with a specialty pharmacy, to kind of help navigate through these situations when dealing with insurance. Can you just briefly talk about that relationship?
Yeah, so we have a partnership with a specialty pharmacy that particularly the Walgreens out of Knoxville. And they can ship anywhere in the state, but they really helped and guided and taught me how to do prior authorizations. They were really fabulous to take that on to allow us to send to them and them to assist us. And then as we grew and had more providers, like I said, I took on trying to learn to do it because I didn't want to overwhelm them. Um, but we run into all kinds of unique challenges with insurance and they have even more expertise. So they're grading and helping us figure out how to get this medications for our clients, as well as like foundations for when they have extraordinary copays. They've been really great to a great resource for me and for our providers as well.
Yes, so definitely we would encourage, if you are interested in, um, pursuing billing insurance for treatment, or just, if you have generalized questions, um, building a relationship with a specialty pharmacy, as they are incredible at what they do. All right. Well, if we don't have